there was an article published the same year, 2022, which said that climate change is making hundreds of diseases worse. When I looked at the incidence, like so many other things with climate change, infectious diseases are on the increase and they're on an accelerating increase.
Hello, and welcome to another edition of the Climate Emergency Forum. We're happy you're here with us today. And today's topic will be accelerated climate change and disease. And it's interesting, if you think about the word disease, you can think about it in two ways. As one word, disease, I think most of us know the meaning of, but also we can separate it into dis-ease, and that is feeling uneasy or concerned. I think most of us, whether or not we are concerned about getting diseases from climate change, we certainly are diseased by what's happening with the climate crisis. But today we'll focus primarily on the narrower version of disease. We have with us, as always, our two experts. First will be Dr. Peter Carter, who is a retired medical doctor from Vancouver in British Columbia, and is the founder of the Climate Emergency Institute and has been an IPCC expert reviewer. I'm Herb Simmons. I'm the author of A Climate Vocabulary of the Future. And without further ado, I'd like to turn it over to Peter.
Okay, so I'm going to talk about the climate change effects on infectious diseases. I can remember years and years ago, a infectious disease specialist, I think it was Michael Patz. He gave a lecture and he says that in theory, all of our infectious diseases are going to be increased by climate change. So he said, on policy, we're assuming that they're all going to be increased. That was a long time ago. And now, of course, we've got some really excellent research, which is confirming that and more specifically. If you can imagine, we've got 14 million deaths a year from infectious diseases. If you can imagine a world where all these diseases are increasing, you'll get an idea why I feel so strongly about the legacy that we are leaving today's children. I try and mention quite frequently when I do a research paper, and I know it affects children more than anything. As we all know, children are the most vulnerable subpopulation to climate change in general. So this is why I try to say periodically that we're leaving a hellish future for today's children. Really, I've got to admit that when I'm saying that, I'm not actually very consciously aware that that's infectious diseases, but of course I am now. I found a great paper, a recent paper, 2022. The title is The Result. Only over half of known human diseases can be aggravated by climate change, over half. So it's an excellent paper. It was basically a literature search with a lot of explanation about what's going on. I'd recommend it to anybody because it's not a hard paper to read. The paper is discussing things that we're all well aware of in everyday life. So it's really, really good. There was an article published the same year, 2022, which said that climate change is making hundreds of diseases worse. When I looked at the incidence, like so many other things with climate change, infectious diseases are on the increase and they're on an accelerating increase. Now, of course, infectious diseases is not the only aspect of health which is increased by climate change. I'll just say very quickly that every health impact that you could think of is made worse by climate change. And of course, the populations who are vulnerable vary. The number one, the scientists have now figured out the percentages of the increase in infectious diseases with their specific cause. Number one by far is just an increase in temperature, which way, way more a factor than, for example, heat waves. So just temperature increase, which we know we have anywhere, and we know it is accelerating. So you just have to put those two together, and the future's not looking very good. The next one was precipitation. That wasn't far behind climate change. So the communicable diseases, as they're called, they're increased by warming, they're increased by rainfall, they're increased by drought, they're increased by storms, they're increased with changes in the natural ground cover. They're increased by changes in the ocean, surface ocean, and they're also increased by sea level rise. So, of course, the big one that I didn't get to is malaria, right? Malaria's killing 1 million people every year. And when I looked at the literature on infectious diseases, it wasn't too clear what was going on. But then I decided I'm going to look at the literature on the mosquitoes. And then I found results which are very, very, very alarming. Over the past years, the IPCC has gone one way or another. It's very, very hard. It's very complicated to determine what's going to happen to malaria under climate change. Interestingly, the last assessment, the sixth assessment of the IPCC, did say for only the second time that malaria is going to be increased by global climate change. Finally, I'll mention there's very recent research on these infectious diseases, which we like to think of as tropical diseases, surging over the United States, as well as surging over the world as a whole. So it's a pretty grim picture. I don't know which one of us chose a topic, but I'm very glad it's such an important topic. And we sort of gloss over it, me included. So that's what I can say.
Well, thank you, Peter. As always, you present very clearly and incisively some very grim news, but very important as you're beginning to flesh out the various dimensions of our topic today and the pervasive impact of heat and other climate impacts on various aspects of disease. And one of the things I wanted to emphasize was that I think most of us, when we think about temperature, we think about daytime temperature and usually a midday temperature because that's when we reach the peak. But it's actually nighttime temperature that in many ways is more damaging both to the ecosystems, to plants and animals, and to us as human beings than the daytime temperature because we're less well adapted to that. And usually, because of the cycles, we cool off in the evening. There was a 2022 study that concluded that the number of deaths due to higher nighttime temperatures will increase sixfold by the end of this century. And these researchers, they labeled this excessive nighttime heat as HNE, or hot night excess. And I guess we could think of other images when we think of hot night excess, but this refers to the excess heat and the excess mortality, the results from the fact that things don't cool down the way they used to in the evening, particularly in the most tropical areas of the world. So with that, as always, I'm happy to introduce Paul Beckwith. Paul, as you know, is a climate systems scientist from Ottawa, Canada, and is a prolific YouTube presenter of hundreds, if not over 1,000 videos on every aspect of the climate crisis. And the floor is yours, Paul.
Yes, thank you, Herb, and thank you, Peter. Hot night excess. It doesn't sound like such a bad thing to me, but anyway, Peter, yes, 14 million deaths per year from infectious diseases and rising. You mentioned malaria being 1 million. I mean, just look at the disease vector, the mosquito. We have an expansion of the tropics. So they're spread in the habitat and range of mosquitoes, and where they go, malaria can follow, of course. On top of these deaths, there's, air quality is a huge issue, killing over 8 million people per year. As we get more and more warming and drying, we're getting more and more wildfires, which is putting up tremendous amounts of particulate matter, which is very harmful, especially the PM 2.5 particles, which can lodge deep inside the lungs, and they can actually be measured throughout the body systems, including the brain. So they increase things obviously like asthma, bronchitis, lung cancer, even brain tumors are on the rise and thought to be attributed to these PM 2.5 particles. And of course, we have droughts and heat waves expanding into various regions around the planet, and they're worse. And we need to be worried about wet bulb temperatures. What temperature, humidity can the body actually withstand? We thought it was 100% humidity at 35 degrees Celsius, but fairly new research shows that the tolerance is lower. It's more like 31 or 32 degrees Celsius with that humidity. And then the body just can't dissipate heat by sweating. So you get heat exhaustion, heat stroke, huge problems. The best way to deal with disease is to be healthy, to eat proper foods and not be overweight, obese. If we're healthy, that's the best fight against the absence of disease. And doctors and the medical system are a big part of that. And they're all being disrupted from accelerating climate change. Of course, we're getting extreme weather events causing torrential rains around the planet. So we're getting large amounts of flooding, and it takes a long time for the waters to recede. And also they can overflow sewage systems and other toxins from industrial sites that are flooded out. And of course, all of these things create tremendous amounts of tremendous health threats to people in those regions. There's also huge amounts of human stress from climate change, people being displaced from their homes, and huge issues with mental health as well. And also that causes increased inequality, especially if people don't have adequate insurance coverage, and it's becoming more expensive and harder to get, so more people are doing without it. And this, of course, contributes to the human health effects. When the human body resilience is reduced from all of this stress, we know that we're much more prone to get colds and viruses and things. So we're seeing a large rise in those sort of things. We're still grappling with the hits to the health community from COVID 4 or 5 years ago. We haven't really recovered from that. Waterborne diseases like cholera, diarrhea are way, way up. By 2050, it's estimated that 1.2 billion people will be displaced around the world. So this, of course, exacerbates all of these problems. Our ability to get enough food, enough nutrition, clean water, all of these things are negatively affected by climate change. And Peter mentioned, and you too, Herb, I think you mentioned this paper called Over Half of Known Human Pathological Diseases Can Be Aggravated by Climate Change. And I just want to point out there's one figure in that paper. I echo Peter, read this paper. It's very readable. There's one figure in particular, figure 3, which is kind of a flow chart connecting all of the climate events to the impacts on people. And then on the far right, it lists the diseases that can occur. And as Peter said, all of these diseases are on their way upwards. So, another huge factor is climate change is driving inequality. When you combine that with loss of local news and with misinformation, especially propagated in social media. These are the conditions necessary, according to Tim Snyder, which chip away at the root of democracy. So we're seeing all of the interplay of all of these factors occurring.
Thank you, Paul. You've really done a wonderful job there in trying to begin to tie together some of the factors that directly impinge and affect our health and our well-being and our ability to fight off disease. And one of the others, of course, that I want to ask you about, which is the surveys are showing an incredibly high percentage of people, particularly younger people, have some or a substantial degree of anxiety, depression when they think about the climate crisis. And obviously that's not great news for the immune system. Would you like to briefly comment on that?
Yes, I think what we're seeing is that very thing happening. I mean, if young people don't feel that there's much of a future, that they've been sort of left out of the ability to buy a home, for example, the ability to save for the future, so financial pressures, higher inflation, all of these things are preventing them from getting a start unless they have wealthy parents that they can lean on, for example. It's very, very difficult to work your way up from the ground up now. I mean, part of the American dream was that, a penniless immigrant could come from a country to the US and start from there and work their way upwards, have a decent life and a good job and so on. And this sort of scenario is much harder for people to accomplish now, I think.
Thanks, Paul. Let me turn it back to Peter.
It's really awful, isn't it, to look at all these papers. There's quite a few coming out showing the mental, emotional, severe effects on young people on climate change. The thing that really, really annoys me is that there's very little emotional, informational being expressed by the adult community. It's my generation that's caused all this and increasingly caused all this. And really isn't doing much of a damn thing about it. I do feel very strongly about it. It's absolutely terrible. So there was another paper I should mention, Camilo Moro in 2020, really good paper, which he included the impact of travel, of course, which is another factor which combines with climate change. And the title of this paper was The Accelerated Infectious Disease Risk in the Anthropocene. I don't like that term, but it's basically the industrial age. Then the rest of the title, more outbreaks and wider global spread. An increasing tendency towards pandemics. So my generation should be really, really scared about this stuff, right? Because it's happening already and it's going to happen faster and faster and faster. We should be out there supporting the young protesters, and we're not, right? They're denigrated in the media, they're arrested, they're handed absolutely draconian sentences, including incarceration, for doing basically nothing to try and bring attention to the adult world that they are very unhappy that they are looking at a future that is going to get worse and worse and worse. So having got annoyed about that, I want to mention that, of course, there are more vulnerable countries. We're going to see, the specialists tell us we're going to see, as I've said already, increasing infectious diseases. We're going to see re-emergence where there was a lot of these infectious diseases, and it's going to come back. We're going to see new emergence, new areas, because infectious diseases, there's maps, and so they're occurring in particular regions of the world, of course. We are going to see new diseases, novel diseases, like the COVID pandemic, increased by climate change. And we're going to see superbugs. We're going to see mosquitoes and other biting little insect creatures, and they're going to be less resistant to the stuff that we use to control them. Of course, Africa is most vulnerable to all of these diseases, all of them. And at the same time, Africa is having its own problems, but it's a sort of hotbed of continental hotbed of reducing variable malnutrition, hunger, periods of starvation, which of course reduce their immunity. So we're in this horrid situation, which is in what we're doing. I say we, my generation, we're increasing infectious diseases in the parts of the world that are most vulnerable. And at the same time, those people are going to be increasingly vulnerable to the infectious diseases because their health is going to be poor as it is. So my final thing is the big factors are warm, wet, and humidity. So you can understand why climate change is increasing all these infections.
Thanks, Peter. I was particularly struck by your comment about the young people who, of course, it's not just young people who are being arrested and harassed and imprisoned in some cases, particularly in the UK, but all over the world, for just wanting to have a future. And it's really hard to put one's arms around that. At least it's hard for me. I suspect for most people as well. And I think what we can do here is, again, encourage those who watch this to stand in support of young people and old people and every kind of person who's fighting against the people who want to make climate change worse, who are fighting against spending more money on public health to protect us against these emerging diseases and problems that insidiously come across us. You know, I also want to just comment on what you said earlier, Paul, about, I think you said exactly, it's harder to be healthy. And you alluded to that as well, Peter. And a couple other examples of that. And researching my book, I came across a paper, and it led me to coin the term climasomnia, essentially insomnia related to climate change, that someone did a study, and I don't know how in the world they figured this out, but they calculated on average every person on the planet is sleeping 7 minutes less a night because of the impacts of climate change. I assume that was peer reviewed. And whether it's a 7 or 2 or 12, it's one more insidious example of how climate change makes us less healthy, makes us grumpier, makes us more anxious, and makes us more prone to disease and illness. With that, back to you, Paul.
Yes, so we know that climate change is accelerating. You know, we've hit record temperatures in the last few years, and the increases are spiking upwards. But, you know, so it's become difficult. It's much difficult to stay healthy and to deal with disease under these conditions, even if the systems to respond to diseases were stable. But I would argue that social media, I'll call them cesspools of misinformation, and misinformation specifically about vaccines is causing a huge thing called vaccine hesitancy, and people are avoiding vaccines. So our populations are becoming much more vulnerable by our reactions to this misinformation. As climate change accelerates and impoverishes people and destroys people's homes, etc., people are looking for scapegoats. And if the people specifically on the right wing in these echo chambers are not being told the truth to attribute what's happening to climate change, so they're looking for other reasons for it. And those other reasons then go off down into rabbit holes of misinformation and utter nonsense. So malaria is, you know, on the rise again. There's diseases that we thought that we had under control that are resurfacing again because of huge numbers of people that are not getting vaccinated, children, parents that are not having their children vaccinated. So we're seeing resurgences of these. So this is on top of all of the other things. We haven't mentioned Lyme disease, so I just want to briefly bring that up because it's accelerating significantly in southern Ontario. Our winters used to be cold enough to eliminate the eggs and keep the populations down, but because of much milder winters, we're getting more and more different species of ticks in southern Ontario, and many of these ticks are carrying Lyme disease. And anybody that's got pets, dogs specifically, that go on walks, that are outside playing, you know, they come back from a field and they can be covered in half a dozen ticks, and they hide behind the dog's ears, you know, near their nether regions, and you have to do a very careful analysis, well, very careful, observation check to make sure your dog's not carrying ticks. We have vaccines for dogs and cats and other animals to protect them from ticks. And interestingly, you know, we don't have such vaccines for humans, as far as I know, at the moment. But, you know, it never used to be a problem. But now, as soon as the temperature goes above zero, so we're in the spring now in Ottawa, you know, ticks, you need to check for ticks. So this is just one example of how, a personal example for me, having a dog and going on multiple walks outside, that it's really changed the game in a way, and hopefully it doesn't worsen quickly. It doesn't become much worse than it is now already.
Well, let's hope so. Thank you, Paul. I certainly appreciate the discussion about Lyme. I've had it twice in my life, and it's something that is moving from being a rare and exotic disease to something that's becoming a common everyday phenomena, unfortunately. As always, I want to thank our panelists, Paul and Peter, for, again, beginning. I say beginning because there's so many more dimensions of the dis-ease and health impacts of climate that we have, and we could and we will be looking at both today and in the future. I just want to mention a couple of things. If you're watching this and you're wondering, well, what can we do? Obviously, one thing is just take care of yourself and your family, be aware of these threats, and do what you need to. Find good public health and medical advice. Try to sift through the misinformation and disinformation. Easy for me to say these things, not always easy to do them, but that's sort of job number one. Job number two, as always, is to do what you can to promote a reduction in the use of fossil fuels, which is the primary cause of the dilemma and the challenge and the problem that we face. And as long as we continue burn, baby, burn, all of the things that we talk about on this program will continue to accelerate and get worse. And then there's a couple specifics, as I mentioned earlier, in your local government, advocate that more money be spent on public health. What could be more important? Just think of the term public health. And yet public health budgets, at least in my country, in the United States, are being cut, largely because of really some terribly stupid reasons that we don't have time to get into. There's also a big lobby that's beginning to emerge among the corporate sector to fight public health measures that would minimize the amount of heat and high temperatures that workers face in their jobs. It's often called the big heat lobby, like big ag or big pharma. And in Florida, for example, there was legislation, I believe, that would have provided some protection to workers from heat temperatures going over a certain level. And the employers basically banded together to fight and kill that kind of effort. And that's happening all over. So get involved in that. Your lives are at stake. Our lives are at stake. Our civilization is at stake. We thank you, as always, for watching and supporting the Climate Emergency Forum. Please go to our website, climateemergencyforum.org. And if you're so inclined, and we hope you will be, to donate so that we can continue to do these programs. Like this video today, if you in fact liked it. Subscribe to our channel. Tell your friends and colleagues about this. And please leave us your comments. Give us your experiences with disease and climate change, your questions, what you'd like us to talk about in future programs. And as always, we'll be back next week. Thank you so much.